I was having some really hard times with managing my life in general. I had some severe chronic pain in my back that had resulted from a car accident that I had about 10 years before. And I also had a very sensitive tailbone and chronic bursitis of the shoulders and hips. And, I was starting to feel like I was handicapped and there wasn't much I could do without assistance. Before I started the PRC program, I could not do much of anything without help. Um, I was not able to even carry my own briefcase unless it was almost empty. I couldn't lift or carry much of anything. When I had to walk someplace, I made it as short as possible. Couldn't walk for 5 minutes or so without pain. Basically going from chair to chair, always looking for the next chair to sit down. There really wasn't much of anything that I could do. I depended on my wife most of the time to, help me with just about anything that I needed to do. And, I thought of myself as a handicapped person. I was just very limited and, just couldn't do a lot of things. After I completed the 3-week intensive PRC program, my life transformed completely. It was really amazing, far more than I even expected out of it. I thought there might be, some relief of pain or maybe just some way of managing it or dealing with it. But what really happened was they gave us a routine that we learned over that period of time that not just helped us learn how to do things with better body mechanics and with better habits or exercising moderation and things like that, but they also helped us understand how the pain wasn't really dominating our lives as much as we thought that it was. And it wasn't just theoretical or psychological as if that was the basis of the pain. It was that once you thought of yourself as somebody who's handicapped and incapable of doing things, then it kind of runs your life. But during those 3 weeks of the program, we had routines that were guided by people with amazing expertise. I'd had bad success with physical therapy in the past. Every time I tried something, it would aggravate the problem and, have flare-ups that would incapacitate me for days or weeks. But these experts at PRC were able to guide me, just enough, right on time to expand my capacity to do everything that I needed, extended my range of motion, doing exercises that I thought I wouldn't be able to do with increasing the repetitions and increasing the strength or resistance, increasing the time that I could walk. And it wasn't just, forcing me to do these things. And it wasn't, telling me that the pain was psychological. It was that each day they had an integrated set of therapies in their approach that, helped enhance your ability to do everything and diminish the pain over this period of time. And so by the end of the course, end of the 3 weeks, I was far more capable of doing just about everything. And that increased capability of, just performing physically, doing most things, increased over time. So that was, really inspired me, and I was just, it revolutionized my life, basically. When I started the PRC program, I was at first very reluctant to even participate because when I saw that they were expecting us to do exercises, and especially when I saw what other people were doing, I was thinking, these people don't have problems like mine. I'll never be able to do those things, to the extent that they seem to expect. They talked about getting off of your medicine. I thought, I can't live without my medicine. I absolutely need it. Can't function without it. They talked about not using the support cushions that I always needed. Everywhere I went, I always had to carry cushions with me so that I could sit comfortably. They talked about how the pain could diminish if you could learn to treat the pain a certain way so that it didn't run your life, that the source of the pain would actually be diminished. And I thought, I was very suspicious of that, but I was desperate. So I started, and I went with it, and it was just everything that they said. And I have to say, I was just extremely impressed with the personnel there. The staff had the expertise to do just the right thing at the right time and expanded my capability so that I was able to do these things. So, I learned to do things in moderation. I learned to practice good body mechanics. I learned not to just give in and surrender to the pain. I learned that I could be more active, and being more active and being more, having more of a physical exercise routine on a regular basis, I learned just during those 3 weeks increased your ability to do that even more, so that you could be more active. If you could push it just a little bit, then you're able to push it just a little bit more. And the secret in that case was not to push it too much at a time. And that seemed to be the problem I had with physical therapy that I'd taken in the past. When I first got home, I found that after the 3 weeks of PRC, I found that I could do a lot more things than I could before as a result of what happened to me over those 3 weeks. So I have been told by the staff at PRC that you really do need to continue this routine. And so I did. It turns out that when I finished the PRC program, I went on travel. I caught a plane, I think a couple of days after. It took almost all day. I was on the plane for about 20 hours. And so I went right into a routine where it was actually not routine. And it was hard to do the same kinds of, stretches and aerobics and things that they said should be continued. But I believed in it so much, since it had already done so much for me, that I did what I could. And so from the start, and for subsequent weeks, I was very, very conscientious with that, to the extent that I could be. And I found that I had good results over the first few weeks, and I guess the first few months. I found that things really did improve, even from the point right after the program. So I was inspired to continue. And I also did find that there were times that I couldn't do it. I couldn't follow the routine. And that means, I wasn't able to exercise moderation in my activities. I wasn't able to, do my stretches and my exercises, and so forth. And I found that when I slacked off of it, for a few days, which happened at certain times when I've traveled a lot, that it had really made a difference, and that being regular and being conscientious with that routine would make a big difference. And so I made it a priority in my life. It hasn't been easy all the time, but being a high priority, I decided, I will always make time for it. So I don't skip it much. I at least make a gesture toward it, but I'm very regular with it because from my experience, I found that, if I don't do it, then I tend to backslide. I don't know how far I would backslide because I never want to go there again. The new person that I feel that I've become, the new life that I'm leading now because of how pain is not dominating my life anymore, is, the way I'd like to live. It's not the way I was before I had my problems, but it's a life that I enjoy very much, and I don't feel limited. I don't feel restricted. I enjoy being active. I was not able to ride a bicycle before. My wife and I bought bicycles, so we've added that to the routine too. And so being active seems to feed on itself and create kind of a momentum. In fact, after the first few months, I actually got to the point where everything was so routine and things were going so well that I sort of forgot about the pain. It turns out that, I wasn't cured. It wasn't gone. Everything wasn't behind me. If I slacked off of the maintenance routine, if I, once again, every time I had some kind of pain, just kind of gave into it and got back into that routine, probably if I'd gone back on my medicine, which I didn't, it's another revolutionary aspect of my life. I am actually not taking any pain medication, something I didn't think was possible before. If I would just back off of those things, then some of the problems would start to recur. And I really do think that the basis of the problem is significantly diminished, but it's not completely gone. And so it is important, to keep up the routine that's maintaining my ability to live a much better life. I'm able to sweep. That was something that was a problem before. I'm able to do a lot of things around the house using better body mechanics. So the stretching, the body mechanics, the strength training. I ride my bicycle without feeling winded, without feeling a lot of pain for long periods of time, meaning 45 minutes or something like that, and I couldn't walk for 5 minutes before that without pain because of the ongoing exercises that increase my strength, So there's the aerobics, there's the strength training, the body mechanics, and also the fact that whenever there's any new kind of pain, of any twinge of the old pain, not to just overreact and start taking medication again or start to obsess with it like I felt like I had to before, because it did seem to control what I was able to do in life. I think that one thing that was most helpful about the tools that they gave us in the PRC program was the stretches. That seems kind of simple, but I was not able to turn and twist like this, not at all, just very little. And sometimes you have to, like if you're, driving in reverse and you have to turn. If I did that, it would create pain in my back and a kind of inflammation that would cause it to swell. I need to take, more pain medication. I would need to put ice on it, and it would last for at least days. But doing the stretches I found, which is part of the ongoing routine, has, maintained my ability to move in certain ways to a further extent than I was able to before. And that allows me to do a lot more different types of exercises, and not just, exercise for the sake of exercise, but, just living life, doing more things, more recreational things, doing housework. The body mechanics was a very important aspect of what I learned on PRC. I'm able to, like hand wash the dishes where I was not able to stand, leaning over or something like that. That was a problem. Do a lot of traveling, folding the clothes, managing the luggage. Of course, I still don't try to lift heavy luggage or anything because, moderation is an important thing. Don't do anything that's foolish given my history. And another aspect of the program, which was very beneficial, was there was a family component of it. There were meetings with family, and my wife attended those meetings, and so she understood everything that was happening. She understood the PRC philosophy on medicine, and not just philosophical, but the practical implementation of scaling back the medicine, of not giving in to the problems with pain, of using good body mechanics, not trying to shrink away from doing just about, anything that might cause a little bit of a challenge. And so she was very supportive because she understood everything that the program was trying to do. And continuing with the momentum that the program created was very important to not just continue to, live life better, but to continue to progress, which I've done over the past year and a half. I have had a much better social life since I've done PRC. I had a pretty good social life before then, but there were things that friends wanted to do that I was not able to do, so I always had to say no. For example, anything that required a bit of walking, I always had to say no. And that was a little bit of a problem because, my wife and I like to do things together, and we had the same friends, and we would have activities that our friends wanted us to join them doing. And, now we do this. Just about a week ago, we joined some friends to go on kind of a nature walk that was about, maybe 45 minutes or something like that. And I was doing fine before I had to sit down. Then I did find a seat and took a break, because moderation is very important. If you strain yourself, then, you're kind of allowing the problem to, once again restrict what you're able to do. So things like that, things that are more active, that require more standing or more walking, we're able to be more active with our friends than we were before. And I say we because, basically I was limiting my wife's social life also. And so this has been great for her because, our social life is better. It's great for her because I can do housework, I can do things around the house. I don't always ask her, help me do this or do this for me the way I did before. I know how to do things, with leverage, with proper postures, with techniques such as, dragging things if you can do that, or, rolling things, or, just different tricks to accomplish things that you would normally not think of, that you would normally just approach with brute force, or I would anyway. It's probably not wise for anybody, but just learning how to do things in a way that's not a strain on the body which is common sense, even if you never had any problems. That's allowed me to have a much better social life. What I can do these days that I was not able to do last year before last, I guess, before I started PRC, include, certain things when we travel. We do travel a lot. We are going to South Africa in a week, I think. And we always wanted to go there, but we couldn't do it because some of the rugged activities that we'd be involved in, such as a safari where there's lots of bumps in the ride on the Jeep or something like that, would cause a severe flare-up. And it's something that I just couldn't think of. It would be untold misery to just imagine myself on that type of thing. So we're able to, and later on, in the year, we're going to India and somewhere else. These are things that I can feel a lot more casual about now because the types of things that we do are not as restricted as they were before. I don't have to depend on my wife, and as much as before, I participate so we can, go on tours or, whatever kind of activities we're doing. We can do things together when we travel that we were not able to before. And we're also, I'm able to help with all the challenges of travel more than before. So we like to travel. We travel a lot. We travel more now than before because we're more able to do it and more able for me to enjoy it by being able to do more activities, and for her to do things with me, for us to do things together when we travel. So that's a big part of what we do these days that we weren't so much able to do in the past. I think that anyone with chronic pain, especially debilitating chronic pain like I had, should seriously look into PRC. My experience, it just absolutely transformed my life, and I enjoy life a lot more than I was able to in the past. I feel like I'm a different person, and I would have given anything to make that happen. And that was my experience, and it worked for me with the integrated approach with all the different, therapies, the psychological, the social, the occupational therapy, the body mechanics, the exercises. All of it just came together so perfectly that it seemed to me that it would benefit anyone with any type of chronic pain. Of course, I don't know much about chronic pain. I only know about my own problems. And that was just an amazing solution to me that I think if it's possible for someone else, I think that you'd probably find out by looking into it and having the evaluation and the interview. That is the way that you could find out whether the type of thing that they do is something that would apply to your own type of problem. Even if someone would not have the same results I did, because, of whatever reason, I have no idea what all of the parameters are that would determine the degree of success that different people would have. But I would say that because of all the different ways that they approach your problem, it would benefit anyone, I would imagine, and would improve your quality of life significantly. It seems to me that what you put into it determines what you get out of it. And so anybody who goes through the program should really take every aspect of it seriously. I think that the PRC staff are experts. They really know what they're doing. They have they're caring, they're experts, they have experience, and I think that if you actually take to heart what they're saying, which is what I did, that you'll get a lot of benefit out of it. It's hard for me to imagine that you would not, but certainly the only people that I've talked to who didn't feel like they had great success, those few people, they were definitely in the minority, they didn't try it. They didn't take it to heart. They were kind of looking for an instant cure, and when that didn't happen for them, they just abandoned it. But for me, I found that after the 3-week program, I had experienced significant success that inspired me to continue with the routine that was recommended. And after a few months, my success improved a lot more than that. And so I would say to anybody who's going through the PRC program that you really need to resolve, you really need to make up your mind to give it a serious try, make it a high priority, and I suspect that you will be amazed at what it does for you.